So this is the Pentero. This is commonly used for tympanomastoids, cochlear implants, and other large ear cases. So what I'm going to show you is how to balance the microscope, change the side oculars, and then a couple of things dealing with the light. So you're going to hit auto balance. It's going to give you a message not to do this over the patient's head. You're going to use the green buttons on the back of the handles to unlock the microscope and drag this ball to the center of the box. Once it's there, release the green buttons behind the handles and select the top one, auto balance the complete system. And this will automatically balance the microscope. Once balancing is complete, it will give you a message that it's been successful, and you can click OK, and the microscope is ready for use. If you need to switch the oculars, the side oculars to the other side, do this very carefully. This configuration is set up for a right ear case because the observer oculars are on the left side. However, if you want to do a left ear case, you're going to move the observer oculars to the other side. And to do this, you're going to remove this cap. And there is a dial here that says open. So you'll turn it towards the arrow to release this. Always have a firm hand on the observer oculars so that it does not accidentally drop on the floor. Very gently plug this in to the other side. And turn the dial in the opposite direction of open. Give this a firm shake to make sure that the oculars are actually seated, which they are. And then before rebalancing, move the observer oculars to an appropriate space for the observer. And if you are unfamiliar, please ask your resident where he or she would like this positioned. And then you'll need to rebalance. Do the same thing. Before unlocking with the green button, know that your microscope is going to tilt very heavily to the right side now because we've changed the balance. So have a firm grip on both handles and know that it's going to swing right. So oppose it to the left side. And again, move the ball into the box. Release it and rebalance. Select OK. Tuck your oculars back in so they don't get bumped. And next we'll go over some of the light features. Up here it tells you the light is on 36%. This is a normal light intensity. Some of your doctors will have their profile set to limit this. However, Dr. Rubenstein does not. Changing users, you hit user, and you can select your doctor from this menu. Go back to menu for the home screen. To turn the light on and off, click on maximum light, and light is on and off with this button here. You can decrease the light intensity manually here, or the surgeon can do so on the handles. Another feature is that once you've applied a drape to the microscope, it'll suck out all the extra air simply by hitting drape. In order to get the best result, you want one of your ties on the drape to fall tightly between these two black lines, or all the air will not get sucked out. Another issue that comes up infrequently is whether the surgeon would like the percentage of light intensity to actually show within their oculars. To turn this on and off is hidden in a menu called Configuration under Multi-Vision and OPMI Display. You can simply turn the light on and off in their oculars. To shut down the system, you just need to be on the menu screen of the home screen and turn the green switch off. Let the system shut down for about 2 minutes before actually unplugging the microscope, because the computer is still shutting down even once you have a black screen. And that's it.